Welcome to our third episode of Lupus Minute. As you know, we will be doing these small little episodes during the course of May for Lupus Awareness Month. Our theme this year is Beyond Lupus. Join us as we look beyond the surface and consider the many different aspects of this complex and often misunderstood condition. In today's episode, we will be talking about treatment for lupus and then lupus in men. So let's take a look at treatment of lupus first. Treatment for lupus depends on your signs and symptoms. Determining whether you should be treated and what medications to use requires a careful discussion of the benefits and risks with your doctor. As your signs and symptoms flare and subside, you and your doctor may find that you'll need to change medications or dosages. The medications most commonly used to control lupus include non-steroidal anti-inflammatory drugs, or NSAIDs, over-the-counter non-steroidal anti-inflammatory drugs such as naproxen, ibuprofen, and Celebrex may be used to treat pain, swelling, and fever associated with lupus. Side effects of NSAIDs may include stomach bleeding, kidney problems, and increased risk of heart problems. Anti-malarial drugs. Medications commonly used to treat malaria, such as hydroxychloroquine, affect the immune system and can help decrease the risk of lupus flares. Side effects can include stomach upsets and, very rarely, damage to the retina of the eye. Regular eye exams are recommended when taking these medications. Corticosteroids. Prednisone and other types of corticosteroids can counter the inflammation of lupus. High doses of steroids, such as methylprednisone, in other words Medrol, are often used to control serious disease that involves the kidneys and brain. Side effects include weight gain, easy bruising, thinning bones, high blood pressure, diabetes, and increased risk of infection. The risk of side effects increases with higher doses and longer-term therapy. Immunosuppressants. Drugs that suppress the immune system may be helpful in serious cases of lupus. Examples include azathioprine, mycophenolate, which in other words is Salcept, methotrexate, cyclosporine, and leflunomide. Potential side effects may include an increased risk of infection, liver damage, decreased fertility, and an increased risk of cancer. Biologics. This is a different type of medication, like belimumab, which in other words is Benlysta, or Safnelo, which is administered intravenously or via self-injection. Also reduces lupus symptoms in some people. Side effects include nausea, diarrhea, and infections. Rarely, worsening of depression can occur. Unfortunately, Benlysta and Safnelo is not available in South Africa, but others like Humira, Xalians, or Xaljans, or others are available and used in South Africa. Rituximab. This may be beneficial for some people in whom other medications haven't helped. Side effects include allergic reaction to the intravenous infusion and infections. Now let's look at lupus in men. Does lupus occur in men? Lupus can develop in anyone, male or female, of any age, including children, teenagers, and adults. Research suggests 1 in 10 of those with lupus are male. Men develop the same typical clinical manifestations of lupus as women, yet certain key symptoms may be more pronounced in men than in women. For example, when men with lupus have kidney involvement, it tends to be more severe. Research suggests that men who have lupus experience a more severe form of the disease. Experts don't know what causes lupus or why it affects more women than men, but lupus and other autoimmune diseases can run in families. Certain ethnic groups, including African, Colored, African American, Asian American, Hispanics or Latino, and Pacific Americans, are at higher risk for developing lupus than the rest of the population. Treatment for lupus in men is nearly identical to treatment in women. However, certain medications used to treat lupus, such as cyclophosphamide, can affect sperm counts. Before you begin taking any medications, talk with your doctor about how they may affect you. We encourage you to reach out to other men who, like you, are learning to live and cope with lupus. You can connect with other men with lupus through Andrea's Gift. We encourage you to reach out to us as we have a male support group as well. What are the symptoms of lupus in men? Some studies show that men with lupus commonly experience low blood count, cardiovascular complications, which refer to the heart and blood vessels, unexpected fever and weight loss, antiphospholipid antibodies, which can increase the risk of blood clots, renal disease, in other words kidney disease, serositis, which is inflammation of the serous membrane that often causes chest pain when taking a deep breath, extreme fatigue, pain or swelling in joints, swelling in the hands, feet or around the eye, headaches, skin rashes, lesions or acne. Thank you so much for tuning in to this week's Lupus Minute. We will see you next week, and don't forget to like, comment, share, subscribe, follow, and sprinkle a little bit of lupus love in the comment section.